Okay, great. So we have marked, let us see the marking. Okay, shoot please. Okay, so almost थोड़ा सा और straight करेंगे.
So this is parallel to the bone you are going.
नहीं, straight मतलब ये tilt है ना, ऐसा थोड़ा कम tilt करिए. वो squaring proper नहीं है. Yeah, sorry दीपक, क्या कह रहे थे?
Angulation of your spinal needle.
Yeah. Shoot please. नहीं. थोड़ा ही straight. हाँ, बस अब दिखाइए. So we are trying to square. नीचे आइए प्लीज, नीचे आइए. हाँ, शूट करिए. Okay, so Deepak, can you appreciate?
Yes, we can see.
Okay, so I am on the left side of the patient.
Right.
This is a AP view.
Right.
We are now paramedian. So basically, see, the idea is to give drug. एक shot और लीजिए. So either you give the drug from this side,
right,
or you give the drug from this side. You know, that's the basic idea.
Understood.
So and it has again been reported that paramedian steroid is at times has better results as compared to even transforaminal as well as midline interlaminar. So it is the upcoming
and it
tricks.
Looks simpler also.
Yeah, shoot please.
Can you tell us the angulation of your?
No, we'll go straight.
You'll go straight.
The C-arm is tilted a bit, but we are going to go straight. The same technique. Yes. Shoot please.
So instead of 2H's needle, you are using a spinal needle now?
No, this is a 2H's needle.
This is
Shoot.
a 2H's, okay.
Shoot. Shoot please. Okay. Lateral. Sorry. ये कह रहे? हाँ, ये ऊपर का है ना? Yeah. Now lateral please. नीचे ले लीजिए. और नीचे कर लीजिए. हाँ, शूट करिए. Okay, good. बस. Shoot please. Yeah. Thanks, sister. So now basically loss of resistance technique again. Yeah.
So it's absolutely the same technique except you are paramedian.
Yes, and another thing, when I was in this patient, when I just pierced the epidural,
right,
there was a slight wince. So that is also another, apart from loss of resistance, that is another patient feedback to you that you have crossed and now you are there.
Slight what? Sorry?
Wincing, little
Wincing.
pain,
Okay,
little pain. Yeah.
Okay.
Shoot please. Okay. Dye, yeah. So now I'll be injecting the dye. Shoot, please. Okay, the dye is flowing. ठीक है?
Where do we see the dye? In the superiorly?
Yeah, superiorly.
Right, right.
I think inferior again, Deepak, because of the large disc,
Uh-huh.
perhaps the flow is not proper.
Right.
So, एक AP भी करके दिखा दीजिए. We'll put it in AP. AP में डाल के देख लेते हैं. Yeah. हाँ, वो नर्व रूट के लॉन्ग थोड़ा सा नीचे का टेल सा दिख रहा है, बट वहीं पे तुम्हारा फ्रैगमेंट होगा जो और टिल्ट कर लीजिएगा ऐसे.
Message for the delegates who have not
Bus,
taken
bus.
their I-card and coupon, please take it from the reception counter because
Should
coupon
be.
will be required for the lunch. All who have not taken their coupons, please take the coupons from the counter with the registration badge so that you can have a lunch. Thank you so much.
So Deepak,
Yes.
you see the dye flowing superiorly.
Yes.
Also you can see the exiting route, the route above it.
Yes.
ठीक है, subpedicularly वो dye उधर जा रही है, and there is a very small amount of dye going towards the S1.
Right. We can see that.
Yeah, dye. मेरे को थोड़ा सेंसर के डाइल्यूटेड ज़्यादा अमाउंट चाहिए रहेगा. ये हाइट बढ़ा लीजिए और ऊपर कीजिए. थैंक यू. शूट. ओके, नाउ अभी शूट करिए जरा. शूट करिए. See, you can see some dye flowing below the needle towards the root,
Yes.
the
yes.
S1 root. ठीक है?
Yes. Yes, yes, we can appreciate
Yeah,
it.
and just see that there is no flow towards the right side. Shoot,
Right.
please. ये देख रहे हो रूट के लिए
हाँ.
नीचे जा रहा है.
हाँ.
So the same thing, like giving multiple blocks, or you can position your needle properly to sort of give and target various routes. Now just giving the ये सेंसर के हाँ एक्सा 8 है. Can you dilute it? Thank you. Shoot, please. Okay. Now you see the S1 route, the dye has gone. So if the dye has gone down, this patient, again sensor organ, this patient should have transient relief.
Right.
And at times, so there's a rule of 30 which I, counsel the patient about, that 30% patients will have long-term relief, 30% patients would have short-term relief, and another 30% may not have any relief at all. So they are sort of mentally prepared what they are getting into.
Right, right. Any questions at this point? Thank you, Ashish. We'll shift to next OT.
Yeah, thank you. Thank you,
Okay,
Deepak.
thank you, Ashish.
Hmm.
Anuj,
Sorry?
OT